Prevention is better than cure. This rule applies to any disease when symptoms are not properly acknowledged. This video, we will discuss crucial symptoms that might occur 1 month before a heart attack. Let's talk about some of them in details. Abdominal pain. Abdominal pain is diagnosed in 50% of cases of a heart attack. Empty or full stomach nausea, feeling bloated, or having an upset stomach are the most common symptoms and are likely to occur in both men and women. Abdominal pains before a heart attack have an episodic nature, easing and then returning for short periods of time. Physical tension might worsen upset stomach pains. Insomnia. Insomnia affects 50% of women and can also include a high level of anxiety or absent-mindedness. Symptoms include difficulty initiating sleep, difficulty maintaining sleep, and early morning awakening. This symptom is diagnosed in 40% of cases and is a strong feeling of being unable to draw deep breath. It often occurs among both men and women for up to 6 months prior to having a heart attack. It's usually a warning sign of a medical condition. Excessive sweating. Unusual or an excessive sweating is an early warning sign of a heart attack. It might occur at any time of the day or night. The symptom affects women more often and is usually confused with the hot flashes or night sweats typical of menopause. It is described as flu-like symptoms, clamming skin, or sweatiness occurring regardless of air temperature or physical exertion. Sweating seems to be more excessive at night. The bed sheets might be damp by morning. Chest pain. Men and women experience chest pains in different intensities and forms. In men, this symptom refers to the most important early signs of an impending heart attack that should not be ignored. On the other hand, it affects only 30% of women. Chest pain can expand to uncomfortable sensations in one or both arms, more often the left one, the lower jaw, neck, shoulders, or stomach. It may have a permanent or temporary character. Hair loss. Hair loss as a symptom of a heart problem affects men over 50. It can be considered a visible indicator of heart disease, and baldness can also be associated with an increased level of the hormone cortisol. Shortness of breath. Dyspnea or breathlessness is a strong feeling of being unable to draw a deep breath. It often occurs among both men and women for up to 6 months prior to having a heart attack. It's usually a warning sign of a medical condition. Fatigue. Fatigue affects 70% of women, and if it is not something you normally suffer with, it can be one of the main symptoms that indicates an impending heart attack. Whilst men have reported this symptom, it is most likely to affect women, according to be described as extreme tiredness, lack of energy and motivation, both physically and mentally, and it increases by the end of the day. It can make simple tasks such as making a bed or showering exhausting. Irregular heartbeat. This symptom occurs with no influence of external factors. Skipped beats or arrhythmias are often accompanied by a panic attack and anxiety, especially among women. It appears unexpectedly and reveals itself differently. Arrhythmia, irregular heartbeat, or tachycardia, increased heart rate. Physical exercises might give an extra stimulus to the increase of heart rate, especially in cases with atherosclerosis disease. Some people report that the irregular heartbeat lasts for 1 to 2 minutes. If it doesn't, a post-fade you may feel dizziness or extreme fatigue. Do not forget to subscribe to our channel. Thanks for watching this video.